Good evening once again and a very warm welcome to Rwanda Television News. My name is Gloria Mutesi. The government spent 11 billion Rwanda francs in 2019-2020 fiscal year on post-harvest infrastructure to reduce food waste and fight hunger in Rwanda. In this report, Ethan Tashabia details how far this investment has gone in yielding the intended results.
Shimimana Claude is the chairperson of Ubumwe Bugamije Iterambere Cooperative of 608 maize farmers in Kamonyi district. The cooperative is one of the beneficiaries of the government's post-harvest investment. They were facilitated in establishing a maize drying facility worth 53 million Rwandan francs, which has seen the quality and the quantity of their maize improve significantly. In the agreement signed with our dealers, they want maize with moisture content between 13 to 13.5% for easy storage and handling. Initially, we would sell off our maize right off the garden at a cheaper price because we did not have the drying facility, and that meant that we made losses. But that has since changed with this drying and storage facility that can store our maize for up to 4 months without any problem. However, vegetable farmers are still facing a big challenge of post-harvest handling because they did not have a well-established storage facility.
Tomatoes
are not resistant to much sunlight or too much rain. Having storage facilities would help in reducing the amount of tomatoes that get destroyed by unfavorable weather patterns. The Deputy Director of the Rwanda Agriculture Board, Dr. Ruchagu Charles, says they expect an increase in food harvest between the end of January and the beginning of February 2021. Being a rainy season, he urges farmers to make good use of the established harvest handling facilities across the country to avoid post-harvest losses. What I can tell farmers is to get ready to use those harvest handling facilities spread across the country. If one is not close to them, we'll reach out to them using mobile dryers. We are going to embark on this exercise together with our partners to make sure that we attain maximum harvest possible that will be sent to the market with good quality. Experts in agriculture urge farmers to ensure proper and timely harvesting to reduce post-harvest losses. The government spent 11 billion Rwandan francs in 2019-2020 fiscal year on harvest handling and drying infrastructure to reduce post-harvest losses and fight hunger in Rwanda. Statistics from the Ministry of Agriculture shows that agriculture generated $418 million of revenues in 2020. Reporting for RwandaTV News, Ethan Tashabia.
Election observers from the African Union and the Central African Economic Community have confirmed that the December 27, 2020 elections were well attended and peaceful. When they released the provincial report, the observers thanked the Central African Republic for its political maturity and for its participation in the elections despite voting delays in some polling stations, while some voters were not wearing face masks or observing social distancing as a way of protecting themselves against the COVID-19 pandemic. In regards to the campaign, there were some places that were not reached because of security threats. This is in addition to the fact that some of the opposition candidates had stopped campaigning in support for the cancellation of the December 27th general elections, a decision that was nullified by the Constitutional Court. The African Union election observers, led by former Mali Prime Minister Sibide Moribo, and SEYAC, led by former Burundian President Sylvestre Nibatunganya, also praised the role of the international community, especially the UN mission in Central Africa, MINUSCA, that have tightened security and provided election material. Coming back to Rwanda, as the death toll from the COVID-19 pandemic and the number of COVID-19 infections continues to rise at an alarming rate, health authorities in Rwanda are urging anyone with symptoms to be tested immediately, citing delay in testing as one of the reasons for the increase in fatalities in the country. Rwanda's efforts to prevent the spread of the coronavirus have already yielded tangible results after nearly 7 months of the outbreak in Rwanda. However, in the last 2 months, the situation has changed. The number of people getting infected and killed by the pandemic is alarming. These days we find it difficult because we hear of many people getting infected on a daily basis, and now the death toll is also increasing. These days we're scared because we've heard that it's a serious disease that affects the human respiratory system. That's why we have to avoid it by social distancing and wearing our face masks. It's not only the general public that is concerned about the escalation of the pandemic. Health authorities also fear that if measures aren't followed, things could get worse after the festive season, as Dr. Sabe Nsanzimana from the Rwanda Biomedical Center explains. As you remember, at one point we had 30 COVID treatment centers, which came down to just 5 across the country. But this week we had to open another clinic that was closed because the number of patients was really rising, and the number of patients was higher than the health facilities that were open so far. So we urge people to take care in the festive season. We are concerned that after the festive holidays, the numbers of those infected will multiply, including fatalities. It would be unfortunate to start the new year with the pandemic spreading as well. Whoever is listening to us should respect the set guidelines because times are hard, so that when we finally get the vaccine, the pandemic wouldn't have taken over, and yet we've tried everything possible to avert the spread. Dr. Saben Nsanzimana also urges whoever has symptoms of the coronavirus to go for testing immediately, so that if they are infected, it can be dealt with to avoid the further spread. Research shows that for every one person infected, there are 9 others who have not been identified, yet they are positive. We are seeing people coming in late and telling us that they've had the flu for 2 weeks, and yet otherwise they would have had it for 1 week. Others would tell you that they had fever but thought it was just fatigue. So we are here seeing a very high incidence of patients, twice more than those we used to receive, as well as those that are critical. For example, at the Kanyanya Treatment Center, patients that needed oxygen would not go beyond 10, but now they are more than 40. That is why we urge people with symptoms to not think it's the normal cold or anything. The first thing they should suspect is COVID-19 to avoid infecting others. Currently, the rate of the coronavirus infection in Rwanda is 2%, while the percentage of coronavirus fatalities is close to 1%. Related to COVID-19, while some local residents are still not adhering to the COVID-19 preventive measures, health officials are requesting institutions in charge of infrastructure to construct more public hand-washing facilities in order to mitigate the spread of the coronavirus. Jen Mutoni has more.
In March, when the first case of COVID-19 pandemic was reported in Rwanda, all public areas constructed public hand-washing facilities. However, as time passed by, people have started to neglect the COVID-19 preventive measures by some not properly wearing face masks, not practicing social distancing where it's crowded, and not washing their hands as often. Some of the locals find this issue alarming. In order to prevent COVID-19 from spreading, each and everyone needs to feel responsible and stay cautious. People need to wash their hands or use hand sanitizers in order to protect themselves and others. I don't see how hard it can be for one to take a few seconds to wash their hands. On one hand, some hand-washing facilities are no longer functioning as there's no water supply and no soap available. Some business people are also forgetting to remind their customers to wash their hands before entering their shops. All these are issues that have been put forward by some of the local residents. Like now, I was trying to wash my hands. The first tap had no water coming. Likewise, the second one. There was no soap as well. We request that these facilities get fixed so that we can have running water and soap. In the markets, people still wash their hands, but in shops, sellers forget to remind their customers to wash their hands. Some sellers still don't understand the importance of encouraging their customers to adhere to the COVID-19 preventive measures. Nyarugenge district officials say they plan to repair public hand-washing facilities that have been damaged as they request locals to safeguard them. All damaged hand washing facilities will be fixed with the help of some private businesses during this week. We have hope it will be successful, as locals are required to safeguard them as well. The Director General of Rwanda Biomedical Center, Dr. Sabin Sazimana, says this is the time for people to strictly adhere to the COVID-19 preventive measures, as the situation is predicted to worsen in the near future. During the past few days, people had stopped adhering to the COVID-19 preventive measures, thinking it has come to an end, yet that's when it has just started to worsen. It is time for us to be more cautious than ever. It's time for all people that were taking this lightly to be more safe by repairing hand-washing facilities and placing more hand sanitizers in public areas. During evening hours, hand-washing soaps are not available in markets and bus stations, while some people are spotted not wearing face masks properly. Jane Mutoni reporting for RTV.
Thank you, Jen, for that report. Now, the Rwanda Food and Drug Authority is once again urging food, beverage and pharmaceutical manufacturers as well as exporters to apply for quality certification that will allow them to operate not later than next year. The institution says that the products that do not conform to the quality assessment will be in violation of the regulations and that they will be restricted from the market. Another call for food products registration comes at a time when industrialists and importers allege that they still face the challenge of obtaining quality certification due to rigorous requirements in the new quality assessment regulations and the high cost of quality certificate application. It's a challenge because there were no prior consultations about the benefits of registering our products with the FDA as industrialists. For instance, we didn't have a say about the prices they established because to register one's factory costs $200,000 and $500,000 to register each product. For us with few products, we paid $2.2 million. But all this is strange because as much as we pay all this, we don't see how we will benefit from it. These concerns go beyond local manufacturers to the importers of food and beverage products and pharmaceuticals, who also say that obtaining certification is difficult because many suspect the process is not transparent. Shaka Bruce, the president of the Rwanda community living in China and the head of the Rwanda Speed Freight, an exporting and importing company, say they wish for the quality certification of some products to be issued in Kigali before being exported, and affirm that some locally made products match international standards but are limited by certification hurdles. At the beginning of 2020, a list of 6,000 drugs was compiled, with importers given time to provide information about these drugs. Applications for licenses have now been received for more than 2,050 types of drugs, and the rest have been given not later than January 15, 2021, to have applied for quality assessment certificates. Regarding to the food products, they have until 31st of January 2021 to have registered their factories and up to 28th of February 2021 to have submitted their applications for food and beverages made in Rwanda and those imported. Those that would not have fulfilled this by 31st March, their products will be recalled from the market. Alex Gisagara, the head of Food and Drugs Inspection and Safety Monitoring Department at the FDA, says that a list of drugs and foods on the Rwandan market has been compiled and given time to comply with these requirements, including being registered for each food product and assessing them to see if they meet the required standards. All the products that will be on the market past the dates we mentioned will be illegal. For instance, here in Rwanda, if there are products manufactured here and will be exported, you're required to have certification, otherwise it won't be approved. At least if you buy from a distributor in China, let them show that they are certified and legal in China. According to the FDA, from 2018 to 2020, in Rwanda, 636 food and beverage industries were licensed in the first phase. The second phase had 23 licensed, bringing the total to 659, out of which 175 were the ones that fulfilled quality assessment requirements, with 484 operating without conforming to quality standards. Among the 175 that applied for certification, 61 were approved, with 114 pending approval. And in other news, some people who have graduated from the poorer categories of Ubudehe social stratification say that the people should cultivate the culture of working hard instead of waiting for handouts from the government and other well-wishers. According to some citizens that have moved from less poor to self-sustaining categories, hard work is the only solution to economic improvement. Ubudehe social classifications are reviewed after 5 years, basing on the Integrated Household Living Conditions Survey conducted by the National Institute of Statistics. The 5th Integrated Household Living Conditions Survey shows that Rwandans supported by Vision Umurenje program reduced by 15.6%, while poverty rate was 16%. Experts say that the COVID-19 pandemic has been one major setback in Rwanda's push to eradicate poverty. That's it for tonight. On behalf of the entire news production team, thanks for your company tonight. I wish you happy and safe holidays. God bless you and keep you. And until next time, I'm Gloria Mutesi.